Hi, I'm Ryan Hunter, and this is Kalispell Connections, a program where we talk about issues important to the community. With me today is Sean Patrick O'Neill, the housing manager with the Community Action Partnership of Northwest Montana. Hi, Sean.
Hey, Ryan. Thanks for having me on Kalispell Connections.
Yeah, absolutely. Glad to have you. So I wanted to talk with you specifically because, our community is undergoing just rapid growth. We had a housing crisis in this community before the pandemic, but the pandemic has really supercharged it with a lot more growth, a lot more people coming in, and prices, housing prices, rental prices are all going up. Availability was already, next to zero, and that's a huge issue as well. So, there's just a lot of folks who are faced with crisis, I think, on housing. I know several of them personally. And so I know Community Action Partnership is really one of the central organizations in Kalispell providing housing assistance. But I was wondering, before we get to that, could you talk about a little bit what you're seeing in the community and the impact this growth and the housing crisis is having in the community?
Certainly. So you hit it on the head on the nail on the head. But basically, we're seeing exactly what you were kind of saying there. We're seeing a lot of landlords or owners, I should say, selling their property with the, jacked up, inflated price market for housing these days. And then in addition, we're seeing a lot of renters, unfortunately, that have been, non-payment of rent. This eviction moratorium has really slowed down or almost made it to where there is no housing that's turning over that we're used to with the affordable housing units. And where there is the turnover, that just adds more need or housing instability into our community for those that have lost that housing, because usually there's not much housing to go to from there. So we've been seeing a lot of that combined with obviously the price increases on rent that have been correlated with, pre-pandemic market, and during the pandemic, we've seen it skyrocket. We've always been at around that 1% availability as far as housing units. And so now, I couldn't even give you a real number that I think was accurate at this point, just because it is it's dwindling every day. And we are constantly, our housing navigators, looking for units with landlords that we've built up reputations, rapport with. And it's, it is like finding a needle in a haystack. I hate to say that, but maybe 1 out of 100 units, if we're lucky, is available, and that's luck. Right now, I'd say it's maybe 1 out of 1,000 is probably where we're at. Those may be lofty numbers, but for the households that we're really trying to help, there's almost no housing available. People that are really getting into housing these days are coming in able to afford $2,000 a month for rent on a 2-bedroom unit, maybe a 3-bedroom. And our households that we're usually helping, we're trying to get into a 1-bedroom around $700 with rent and utilities included. So those are almost next to nil out there, and the affordable housing market hasn't expanded. It's actually decreased in the last couple of years.
Yeah, and absolutely. That's what I've seen with some folks I've known. They're forced out of their place because the place has been sold that they were renting, and they can't find it. Folks are going out to Hot Springs to find a place to rent, or they're in really unusual places renting because there's just nothing available. It's incredible. But let's talk about the programs that CAP, Community Action Partnership, offers to help those with needs for housing. Obviously, there's not a lot that can be done about availability, but when there is something available, what are some of the programs you offer?
So, I didn't want to sound sobering, but we definitely are able to help folks get in and out of housing or into better housing that's more suitable for them should they be facing eviction and can no longer stay there. It's just very hard, as everyone is probably aware of, but Yeah, we do offer quite a few different programs. We try to meet all the community needs in this regard as much and as best as possible. We're far, far away from where we would like to be as community action partnership and with where we would like to see our community. Some of the programs, though, that we've been lucky and fortunate enough as a community to have are, rapid rehousing programs, homeless prevention programs. I wish more homeless prevention because that would, mitigate a lot of our homelessness. But unfortunately, these systems have been designed more for rapid rehousing versus the preventative measures. So we do have when I say rapid rehousing, it's kind of what it is. We basically are trying to get folks that are without housing, in a shelter, on the streets, in their vehicles, maybe at a hotel or motel that's been paid for by the Abbey shelter or a church. We try to connect those people with housing and assistance as far as like deposit and rental assistance as quickly as possible. We try to meet their needs as long as we're able in those regards, but it does require participation. The client also needs to show that they have the ability to maintain rent moving forward. So maybe somebody is just starting a job or just lost a job and start, looking for work. We generally like to see that they have that background there and the ability before we move them into a place and set them up for maybe an eviction. So with that program, we're able to maybe provide at least the deposit and first month's rent. And sometimes we are able to help out with a little bit more. But those, we target folks, like I said, that were in those housing situations, but we also have the ability to help those that are fleeing domestic violence with that program. So a little bit of a caveat to that program is that anybody that we're helping that's fleeing domestic violence that doesn't meet those other housing living situations, where they're either homeless, that would be what that is considered, where they're on the street, in a shelter, or in their vehicle, or a hotel or motel paid for by a nonprofit. If they are only just fleeing, and they're doubled up somewhere, or they're, in their own household and trying to get away, or at a motel that they're paying for, we're able to help them, but it does require, like a 12-month lease and a higher level of inspection. So that even limits the, amount of housing for that group even more so. So, we are able to help lots of households every year with that program. COVID has really minimized, obviously, the market for that, but we've still seen quite a bit of people that have shown need, and we've been able to assist them with those programs. Our homeless prevention programs, those are the ones we'd like to have a little bit more flexibility with. Usually we're only able to help out households that with the 30 days prior to their application that they're showing that they're at or below 30% of the area median income. So for a household of one, that's about $15,000. And so we go, off the last 30 days and multiply that by the 12 months. And if that's over $15,000, it's a hard no. Luckily, because of the CARES Act, acts and the funds that we've received from there's been a little bit of expansion on the AMI to 50% of the area median income. So that's closer to around $24,000, $25,000 for an individual. So, we've now been able to help, somebody making minimum wage almost, we wouldn't be able to help prior to these COVID dollars. So now we're getting to where it's a little bit more reasonable. We're able to help people in situations that I personally feel are more justifiable causes, people that are just a few hours lost on their paycheck or had, gotten sick from COVID for the last 2 weeks and haven't been under that COVID. We're obviously getting refunded or reimbursed for any lost wages there. So we have a lot of folks that we've been able to help through that, but then the eviction moratorium comes into play and stops us from being able to help with rental arrears. So because people are not at risk of losing their housing right now, we haven't been able to. Once the eviction moratorium ends at the end of June, we should be able to really roll out some rental arrears assistance. There's also the state rental assistance program, ERAP, Emergency Rental Assistance Program, that you can get on the housing.mt.gov website to apply for. And that is actually able to help out with people in rental arrears up to 12 months. In rental arrears, they have 80% AMI as their threshold, so an even higher threshold, and they're able to help out with future rent as well. Unfortunately, this doesn't help any people really in the homeless category, and there are some people that, it's not being able to help quickly enough in the homeless prevention category. So we've been actually able to step in some of those situations where it's already gotten to court, where even though there's an eviction moratorium, people are still able to evict through the courts, folks for, non-payment of rent, just a common 30-day out, lease violations that they're kind of making up, selling the house. I mean, there's all sorts of issues that have been coming through our doors as in regards to homeless prevention, but we have been able to help some families get out of the court eviction process, and then with some continued rental assistance has helped them actually get back on their feet. So we are seeing some really good successes with that program, and we're able to do a little bit more than we're typically able. So it is nice when we are able to help right now. Institutional Release Program is a newer program of ours. We piloted it a couple of years ago, and we've had a couple of years now of success where we're housing and assisting longer term with deposit and rental assistance with a graduated rent assistance scale for individuals or households that have an individual that's the head of household or co-head of household coming out of an institution, a facility, or a rehab treatment center. So we're focusing on folks that are coming out of jail, prison, mental health facilities, and then substance abuse treatment facilities, so that we can, folks that were homeless prior to entering those facilities and are most likely to be homeless when they exit, we want to try to, get them into housing as soon as they exit or discharge from those, because the chance of recidivism, the chance of relapse, it goes way down whenever we're able to get them housed and then start wrapping around those supportive services that hopefully have been in place at the discharge plan. So we've got that program rolling out. That we're running, and then we've got a new youth homeless demonstration project. So that's a really cool one where we're able to help what is called transition age youth. So 18 to 24 age range is the group that we're really focusing on this to provide permanent supportive housing. And this is even longer term assistance where we're, trying to help folks that are in that age range that maybe have a disabling condition. And then we also want to help folks that are in that age range that don't, but that would be with our other programs. But this one is targeting disabled 18 to 24-year-olds that have been homeless for at least 12 months over the past 3 years. And that can be depending on what their age was. It opens up different categories of homelessness. So if they were younger than 18 for some of that period of time, couch surfing would be an eligible category. Whereas for our normal programs, we're not able to count that because of the youth aspect. We're able to include those homeless months as well. So it would open the door for, maybe high school students that have, a mental health issue that, have some serious issues with their home life and have been homeless maybe for couch surfing for a year. Even while they're in high school, we're maybe even able to, at least as long as they're 18, house them. So that's a really cool program. We're working with Casey Driscoll from the Heart Locker on that to really shore up some ends. We're also trying to expand our partnerships to other, like Youth Dynamics, who's a mental health provider for our youth in the community, just so that we can shore up some loose ends there. And then that is also kind of, the child of our regular permanent supportive housing program. Doesn't have an age range on there. Obviously, we're going to target people older than 24 now that we have this program. But, we do actually have people now that are within that 18 to 24 age range that we originally housed with our permanent supportive housing program. And it's essentially the same thing except for the age range. We have to have someone, that's eligible, would need to be, have a disabling condition and be at least homeless for 12 months over the past 3 years. And so that's really focused towards our highest risk, highest need groups, folks that are, just mentally, physically disabled, homeless for years on the streets is usually who we're targeting with these programs and who we are serving currently with these programs. So that is the one that, we really try to address those people that are falling through all the gaps because there's just no solution for them. This is kind of that housing first solution that we have for them, is get them into housing, try to wrap around as many services as possible, and hope that they engage. So we're really, we're making strides towards just filling all these little gaps. But as you are well aware, with the current housing landscape that we have, housing market that we have, it is not the brightest future for these individuals that we tend to assist, as far as affordability and being able to live in this community. I mean, it would be really nice to figure out some solutions, but outside of landlord engagement and getting partnerships that way, we haven't really had a lot of success. So.
Yeah, listening to you describe those programs, I think, absolutely the housing first with wraparound services is the most effective way of, combating homelessness as I understand it and studying the issue. But it's so difficult because all these funding programs and different programs are so piecemeal, as you were kind of commenting, that it's so hard to pull together all the pieces to have a comprehensive effort that makes the impact that's needed to really solve the problem. And I think part of that stems from this notion that's really been dominant in our society in the United States of the undeserving poor, and kind of the idea that homeless people are, they need to get a job, they're just drug addicts and this sort of thing. I'm wondering if you could touch on that, some of those myths that we've had in our society and that really are widely held, that don't necessarily reflect reality on the ground in terms of the specifics.
Sure. I understand this. I don't want to say a delusion or illusion that there is the stereotypical homeless person is, someone who said good riddance to everything and leave me alone. I don't need any help, or I'm too far gone to be a worthy cause. And I won't lie to you, we see a couple of those. Not very many, but we do see a couple of those where they, would rather just say, leave me alone, and okay, we get that. But there are so many more out there that we see that are struggling in the worst parts of their life and don't know how to get out of this cycle, and it's not a matter of just picking themselves up by their bootstraps and, working a 9 to 5 right off the street, while you're washing in the river down, in Stillwater or whatever. So it isn't like that. We have folks that, for instance, we're currently trying to help a household where there's a disabled adult child and a retired or at least a senior mother that's unable to really, they have very limited income, and they lost their housing because they weren't able to afford the increases, and there wasn't, they had unfortunately not responded in time to the purge letter for Section 8 that they've been sending out annually the last 2 years. And so their names got taken off of the Section 8 wait list, and they weren't able to get back on in time to, be able to get a voucher, which it wouldn't have worked with the landlord anyways, because they said they wouldn't take that reduced amount of rent rate because they know they can make almost double that on the market right now. So we're seeing landlords push out people that were living and maintaining themselves, but now can no longer, or can't transition into other housing that's affordable in a timely enough manner because there's an eviction moratorium. There's a wait list a mile long for every housing that is suitable for them. And I mean, we're looking at studio apartments for these people right now that, you know, are on, I mean, we're talking about physical and mental disabilities between multiple people, and they have income, but it's $1,500 a month between the two of them. And, you know, they're looking at $1,000 a month place. They can't afford that. They can't maintain that. They might be able to survive the winter in that. And that's unfortunately sometimes the case and point that we end up going to whenever we end up getting to wintertime. We have to make those hard decisions at whether, hey, maybe this is the only shot that they have to live through the winter. And we're getting to that case more and more often than I feel comfortable with. And I think we should, as a community, feel comfortable with. But to think, I mean, these people are in their vehicle right now. It's nice out. It's, you know, only 30 degrees at night and 60 degrees during the day with a little bit of sun. You know, yeah, it's not nearly as bad as it was in February when it was -15 out for a week, where they may have died. So, I mean, that stuff we are seeing, you know, I cannot count. I mean, I can because I do data, but we have a large percentage of these folks that are on fixed income because they are unable to work from disabling conditions, or we have such a large percentage of these folks that are working and are trying to get into housing, but they can't save up enough housing or save up enough to get into housing because the market is just skyrocketing right now. If you're working, you know, $11 hour job right now, 40 hours a week, you're still not going to be able to afford the, you know, $800, $900 in rent that your room will cost you when you're sharing with two other people in a $2,000 a month house or apartment. So that's what's going on right now. People are being priced out of the service industry jobs that we have. And so that, I mean, we're seeing people that are, you know, dishwashers, they're stockers, they're, you know, bartenders, waiters, they're working at retail stores. I mean, they're working all over the community, all over the valley, but they could not accumulate enough income from 1 or 2 or 3 jobs in some cases to really save up $2,000 for a deposit and then $1,200 for the first month of rent. I mean, you're talking about some people would be able to get into a home with a down payment for a first-time home buyer loan with that type of money. And so that's what it's costing to get into housing right now. And to say that it's just, you know, people who don't really want help or are choosing this life. I mean, we're seeing people that are breaking down in tears every day because they've never asked for help in their life. But this is the hardest time of their life, and they don't have a rich uncle that can help them out. They don't have a mom or dad that is living on anything but their own Social Security and living in senior housing or having a 2-bedroom house where they can't take all 6 of those. So, I mean, it's just story after story after story after story. I mean, there's tons of people, yeah, that sure would maybe fit the bill that everybody wants to think of the stereotypical homeless person, but it's often our neighbor that had a really bad bit of luck, and now, you know, they're living in their car, or if they're lucky enough, they're in the shelter. You know, I mean, that's the fortunate folks right now that are homeless are living in a shelter. So, and no one wants to live in a shelter. I mean, as nice as it is to have Samaritan House, Warming Center, Peggy's House, Ray of Hope, and Abbey Shelter, no one wants to be in there any longer than they have to. So just in case anybody's wondering, you know, that is a stigma, and it's unfortunate because, you know, it literally is, you know, it could be a sibling that, you know, you didn't realize was on hard times. You know, it's that close. It's people I see every day in the grocery store, whenever I'm at church, or if I'm at the park. You know, next day they're coming in and saying, hey, I lost my job and I really could use some help. So Yeah, exactly kind of the sentiment. I'm sorry if I carried on, but it's one of those things that we try to battle that stigma every day with people internally, like themselves, because they have that perception of what a homeless person is, and then it's something that they actually have to overcome internally to walk through our door and ask for help. So we try to break that down and say, hey, if you're hurting, we need to help you as quickly as possible, because the sooner we do, the less wear and tear on our community it is. The less struggle you have, the less struggle our community will have. So
Yeah, and I've seen that a lot personally too, where folks are in desperate need, but they won't seek help because they've internalized that message that, that's not okay, that you're then a burden on society and a bad person if you seek assistance at all. And it's really unfortunate for folks who are in desperate need and could use the assistance from programs like what CAP offers. But anyways, this topic is so huge. We could go on
yes,
for a long time. There's a lot of nuances to it. We just scratched the surface, but I appreciate your time and I appreciate all the work that CAP does. It's just so important, the work that you're providing to the community, and I hope you continue to do your great work, and hopefully we'll turn the corner here and make some progress on the housing and homeless issues locally. So thank you,
yes.
Sean.
Thank you, Ryan. Hopefully I sounded good and didn't make too much of a fool of myself or Cap.
No, you did great. You were perfect. Thank you
Well,
so much.
thank you, yeah, for the time, and obviously appreciate being on Kalispell Connections. It's a great thing, and appreciate you doing this.
All right. Thank you.